Hi and welcome. I'm Steve Martirano, and this is the Behavioral Corner. You're invited to hang with us as we discuss the ways we live today, the choices we make, the things we do, and how they affect our health and well-being. So you're on the corner, the Behavioral Corner. Please hang around a while. Hi, everybody. Welcome again. It's me, Steve Martirano, hanging on the Behavioral Corner, which we like to think of as being at the intersection of interesting and informative. At least that's our modest hope. The Behavioral Corner is a podcast about everything, because everything winds up affecting our behavioral health. It is brought to you through the cooperation of our underwriting partners, the Retreat Behavioral Health Facilities, about which more you will hear later from them. So that's what we do. Check us out wherever podcasts are being podcasted. We're there. The Behavioral Corner. We have an interesting topic again for you today. We've touched upon the issue of harm control very often here on the program, because apparently you cannot tell people often enough what you're really talking about when you mention harm control. I know that we live in an age where it does not take much to outrage people and to drive them into opposing camps, but one is given pause, at least I am, that the two words put together, harm reduction, in association with substance abuse and death, should arouse controversy. And yet it does. Harm reduction is controversial. There's no way around it. To get a better handle on it, we have reached out to people who came to our attention from our neighboring state, New Jersey. We're in Pennsylvania here on the corner. The New Jersey Harm Reduction Coalition, and their representative, our guest here on the corner today, Caitlin O'Neill, has been with the, I guess you've been with the coalition from the beginnings way back in 2019. Is that right, Caitlin?
Yeah, I'm one of the co-founders. Yeah.
Oh, okay. There you go. Again, there it is, inherent in their name. They're about harm, bringing, reducing the amount of harm in the midst of this devastating substance abuse problem. And now, the tragic deaths, which are unbelievable at this point, are unbelievable. So, Caitlin, thanks so much for joining us. I do want to begin at the beginning here for people who might not understand what harm control is. So in the eyes of the New Jersey Coalition, what do you mean when you say harm reduction?
Yeah. So harm reduction, as a phrase, right? Obviously those two words have meaning on their own. As a phrase and a sentiment and a lifestyle and a movement, harm reduction is a few things. Very simply, it's like a set of principles, ideas, types of service delivery that support people who use drugs in making it through using drugs, whatever their next step is. And so harm reduction as a service is things like access to treatment on demand when it's wanted without barriers, access to sterile syringes, access to naloxone, aka Narcan, the overdose reversal medication, access to therapy, access to housing, access to a bevy of supports that help people survive their drug use. So that's one part of harm reduction. But then harm reduction is also a movement. It's a movement by and for people who use drugs and people in recovery and allies, healthcare providers, mental health providers. It's a movement about the dignity and the rights of people who use drugs.
You really begin to get a firmer grip on this. You're not the first group we've talked to who are dedicated to harm reduction. As you know, it's spreading all over in response to the just massacre that's going on in America with regard to not just substance abuse, but now the mortality from overdose. It sounds like you're right, it's a service, you provide services, but it sounds like there's a growing philosophical movement around this issue.
Yeah. And so it's been growing since in America since the late 80s and in Europe even earlier. And so really it's the idea that, meeting people where they're at, that just saying to somebody, either do this or don't do this, either you're good or bad, just doesn't really work. And we have proof of that, right? SAMHSA, the Federal Substance Abuse Mental Health, whatever the other letters stand for, they did a survey a few years ago that said only 10% of people diagnosed with substance use disorder are interested in seeking treatment at any given time. And so that means 90% of people with substance use disorder who are not interested at the moment in seeking treatment. Doesn't mean that they never will be. It might mean that they never will be, but those 90% of those people deserve to live, deserve options. And so harm reduction really comes to meet the 90% who are not interested in abstinence-based recovery, and says that you deserve a chance for the next day to see what happens.
So correct me if I'm wrong. My impression of the harm reduction movement is that it came out of, first of all, common sense. It would seem common sense, but it rose to fill the vacuum that hopefully would be created once we got past this notion that drugs were to be thwarted as an enemy in a warlike context. We all know that the war on drugs, which is 50 years old, has been an utter and abject failure. Yeah. We have now moved somewhat beyond that to the notion that this is not a criminal justice problem, cannot be solved solely by a criminal justice method, lock them up, but has to be dealt with as a medical problem. So these groups, harm reduction groups, grow up and fill in the void there. Explain for people that when you talk about harm reduction, you're not talking about something purely altruistic, like we're good people, we're going to do good stuff for these poor sufferers. Do you believe in harm reduction because it's efficacious? It actually works?
Well, yeah. So harm reduction is morally neutral. Harm reduction is like, a drug doesn't have a quality of good or bad. It's not a living being. It has no good or badness. It doesn't have those qualities. It's not a sentient being. So harm reduction just says drug use exists and people who use drugs exist, and ignoring them and I should say us, because I am a former injection drug user, ignoring us and throwing us into a corner doesn't do anything. We're still here. We're still going to use drugs. Like you said, 50 years plus of the drug war has shown that you can criminalize the heck out of any substance and there's still a demand for it. If there wasn't a demand, there wouldn't be a supply. And so harm reduction is very morally neutral. It's very practical. It's like you said, there can be a medical model in terms of, what can we prevent? Can we prevent infections? Can we prevent transmission of certain diseases? And harm reduction actually stemmed from the HIV movement in the 80s. And it was basically people being fed up of seeing their friends, their loved ones, their brothers, their siblings dying from HIV because they didn't have access to sterile syringes. So that's really where the roots of harm reduction come from in America, at least. And, that comes out of similar movements like the Black Panther Party, the Young Lords over in the South Bronx. That comes from movements like the movement for bodily autonomy and reproductive rights. It really stems from survivor-led movements. And so, yeah, it's not that we're just saying, we feel bad for people or whatever. It's us. We are doing the work. And I know that harm reduction works because I myself used the syringe service program during my substance use, and it helped me. I'm here today. I'm here today. It helped me survive. And, my work is to just make sure other people have access to that same choice.
Yeah, I don't want to, I'm not here to dwell upon the criticisms or resistance to harm reduction, but they are a huge barrier that I believe needlessly has to, it's there in the middle and you've got to deal with it. It's unfortunate. The programs you mentioned, out of which harm reduction, harm reduction is a part, are all thought of, I think, in the public mind as political movements. Political movements. They think in simple terms, and progressive or leftist political movements. And so I wonder whether or not, in spite of the fact that's the truth of the origins of harm reduction, that isn't something that you also have to overcome, to tell people, look, it's not a political movement, it's harm reduction. Is it a problem?
It's getting turned into one. People are politicizing it, but it isn't one. I always say, overdose doesn't see what party you support. Overdose and substance use affects all of us. And if we turn it political when it doesn't have to be, then it becomes a weapon. Then people don't get access to care. Then our loved ones don't survive. And so it isn't political. Right now, we are in a place where people are attempting to do so and make it political, but it really says that, there is not I don't know a single human being who's not affected by overdose in some way. Whether it's, 2 degrees of separation, 3 degrees, like somebody knows someone who has been impacted by opioid overdose if you live in America at this point. And so I see it as a bipartisan issue. It really surpasses all political things. And if we can keep it at a public health issue, although we are living in a time when public health is being politicized. So that's kind of what we see with harm reduction.
It's not the golden age of thoughtfulness, is it? Anyway, let's leave the notion of controversy and resistance with this one last question, so that people understand.
Sure.
Lowering the harm, providing harm reduction in this context is not an attempt to make it easier for people to use drugs, but to make it harder for them to kill themselves or die. Keeping them alive is the goal, so that they can get clean. Hopefully.
Well, we don't put judgments on what happens what decisions people make. Harm reduction does have a place in recovery, right? Obviously, people can't make it to recovery if they die while they're using, but that's not where harm reduction ends. Harm reduction is about bodily autonomy and choice. Yeah. We know that in America, of all of the people who use an illicit drug stronger than marijuana, a very small percentage of those people even identify as having substance use disorder or addiction. And so we talk about harm reduction as really about choice and about the people who are experiencing substance use disorder and experiencing all the harms that come with that, making sure you stay alive. And in a lot of cases, it leads to recovery, because what happens is people are treated with dignity. People are given a choice. And I know for me, if you give me a choice, I'm more likely to want to work with you than if you're do this now, right? So that's just how we work as human beings.
Yeah. Again, it's hard for people to get their heads around this. I think I understand it completely, that this is a value in terms of what people decide to do when you help them in this regard. That's their decision if they continue using drugs, but it's with clean needles and in safe injection sites, and they have Narcan around the house. Well, then that's their choice, and they go ahead and do it. But for me, the benefit is they're alive, and if they want to stop doing this, they can't if they've overdosed and died. So the door is always open if you can avail yourself of the services of people like Caitlin O'Neill and the group she co-founded, the New Jersey Harm Reduction Coalition.
And actually, my pronouns are they, them. Thank you.
Oh, I'm sorry.
Yes. That's okay.
We talked a lot about the philosophy behind this. The resistance is lessening, I think, in some cases. So in terms of what you guys are advocating, the things you support with regard to harm reduction, tell us about a few of them.
Yeah. So in New Jersey, when we formed in 2019, we were formed, it was really a working group. A few of us stayed on to actually work for the organization, but some of it was just people who were frustrated. Many of us had lost loved ones to overdose. I found harm reduction. Obviously, I was utilizing the services when I was injecting drugs, but I didn't know it was called harm reduction. I just knew it was these people who helped me survive, right? So later on, the way I found it was my partner died from an overdose in 2014. And I was in abstinence-based recovery and not really finding the answers. He was somebody that didn't really work for him, right? Mm-hmm. And I sort of started to think, if this isn't working, what does work, right? What can work? And because we want the people that it works for. Yeah, there's plenty of people that abstinence is amazing and it helps us thrive and move forward, but some people aren't interested, right? And so how can we meet them where they're at? And so I met some other like-minded folks who were frustrated about harms of the drug drug war that they've seen happen: overdose, incarceration, HIV, things like that. And so we formed, and one of our first priorities was naloxone access. At the time in New Jersey, it was, you could kind of sort of get it from certain agencies, but it wasn't really widespread. And so we saw the state was doing free naloxone day once a year or 2 days a year. And we said, we can do that every day. Free naloxone day every day. That's how we keep people alive. Naloxone in every home where there's a chance of an overdose happening, right? And so we really started with that. And what was amazing was the legislation, like legislators listened to us. And, in 2022, we got naloxone standing order passed that says anyone in New Jersey can legally carry, distribute, and use naloxone without a prescription. And now the state has gone even further to make everyday free naloxone day, that pharmacies, you can now in New Jersey, you can walk into a pharmacy and receive naloxone for free from the pharmacy counter without any identifying information. You can say, I need naloxone, and they can give it to you.
Yeah,
and that's huge.
Yeah, that's a remarkable sea change in attitude for people who, I can't imagine, don't know what naloxone is. The generic name is Narcan, and this is a drug administered to someone who has overdosed, and it reverses the effects of that. It saves lives, in other words. Caitlin, I've thought for the longest time now that in our homes, we've all grown up with a little, mom will have a little, or dad will have a little first aid kit. And you know what's in there. When I'm old enough to remember mercurochrome, there were Band-Aids, right? Maybe some gauze and cotton, right? Well, I tell people all the time, if you have young children, teenagers and stuff, that should be in the kit.
Absolutely.
Narcan should be in the house.
Exactly. And you hope you never have to use it, but it's the type of thing that if you have to use it, you want it there. It's the same as an EpiPen. If you have a child that has an allergy, you're going to keep an EpiPen in the house if your child has a peanut allergy, right? And so if you have someone in the house who's, especially like you said, young people who are likely to experiment and be naive about what they're experimenting with. I know myself, my substance use started around 14 or 15. So, which sounds really young, and that's a little extreme. I understand, right? Not everyone's going to do that. But back then, I was fortunate that we didn't have the type of drug supply that we have right now. And somehow, I survived that experimental period in those teenage years. And, we want to make sure that everybody has that opportunity. And so the amazing thing about New Jersey is it's anyone above the age of 14 can walk into a pharmacy and get that naloxone. And again, you're not ID'd, so it's like up to the discretion of the pharmacist to think that you look 14 or over. But I'm really glad that they made it accessible to teenagers as well, because just like condoms should be accessible, even though you're maybe hoping your teenager might not have sex, they might be, right? It's very human to experiment with those things. We think the same thing with naloxone or Narcan, just having it. You might never have to use it. It might expire, right, in your cabinet, but just have it. It's
like the life jacket when you get on a boat. I mean, you don't expect the boat to sink, but you better have the jacket on in case it does. And with regard to Narcan, fentanyl has changed the paradigm dramatically because it has been introduced in all sorts of things that a young person might not be aware of. And so, like I said, Narcan should be in everybody's home first aid kit. The margin of error is non-existent. Let me ask you about a couple of other things. What about needle exchanges? Is the coalition in favor of that?
Yeah, we actually are. We have a service branch and a policy branch, and our policy branch also was active in getting the syringe access expansion bill passed last year, as well as decriminalization of syringes. So, we know that when syringes are criminalized, people are less likely to dispose of them properly. They're less likely to carry new ones, and they're more susceptible to police confiscating if they have new ones. So then they're more likely to reuse or share share a syringe. So yeah, we fully support syringe access. In New Jersey, we currently have 7 syringe service programs, which we call harm reduction centers, because there's so much more than syringe services that happen there. So we absolutely support them, and we are in the works of expanding that as well, and becoming, we believe there should be at least one in every county for New Jersey to get on board. Kentucky, by example, so we have 7. Kentucky, which has about half of our population, has 67 or more at this point. So for a little bit of comparison, we are a little behind, and we're catching up, which is really great.
With regard to those initiatives, harm reduction wise, that meet enormous resistance, I think safe injection sites might be number one on that list. It sets off alarm bells, political fights, NIMBY response immediately. Yeah. What's the situation in New Jersey regarding safe injection sites?
Yeah, so we're not there yet in New Jersey. Like I said, we don't even have enough access to sterile syringes to even think about safe consumption sites yet. We see New York, On Point, New York, with 2 locations. They've saved, they're like up close to 1,000 lives have been saved since they've been open. And so, whether it's controversial or not, I think one thing most people can get on board with is that people don't deserve to die using. And if people can't get on board with it, those aren't the people we're talking to, right? But in the general sense that we can all come together, that people deserve to live, I think is a good starting point. And while it can seem kind of radical, safe consumption sites keep people alive. And what also exists at a safe consumption site is access to treatment. Many across the world, they're much more common in Europe and Canada. They're connected to treatment centers, right? And so they're connected to counseling. So you're not just like going in and being left to your own devices. You're connecting with a nurse, a counselor, someone who's checking in on your day-to-day health.
Yep. When folks hear stuff like this, and they hear you say people deserve to live and not die, some people say, yeah, well, then they shouldn't be doing that. And if they do it, society can walk away from it. They didn't have anything to do with this. Do you think that the spread, ironically and tragically, that the spread of opioid use in this country out of the inner cities, out of the poorer neighborhoods, out of the communities of color, and into the middle class suburban world, it is one of the things that's driving people towards a more humane approach to this? Once it's not a problem of those people, but a problem of all of us. It's funny how people can get aboard. Do you see that happening?
Yeah. Well, yeah. And so the thing is that substance use has always existed in the suburbs, in white communities. In New Jersey, actually, there was a report that one of my colleagues put out a few years ago that says that actually white people use and sell illicit drugs at a higher rates than Black and Latinx people or Hispanic people. And so we've been told this myth, right? The drug war, we even know there's evidence the drug war was targeted to target Black communities and to target communities of color. There's files from the Nixon staffers, right, that talked about the reasons they were doing these things. So first of all, yeah, the narrative that it was quote unquote like those communities, we're here to say that narrative we were lied to, right? But what happened was white communities, middle class communities had more access to care, right? Had more likelihood of having access to treatment and things like that. And so while yes, now that people are kind of seeing more people, unfortunately, with the toxicity of our unregulated drug supply, there is no, like, it's not about doing too much, right? It's about one bag.
You can't kid yourself anymore about the size of this problem and who it's affecting.
Yeah. And so, I was just going to say, so in New Jersey, what we see, like, even though our statewide overdose fatalities have dropped in the past year, greatly due to things like naloxone distribution and harm reduction, we see that they're rising in Black and Hispanic or Latinx communities. And so that is a disparity that needs to be addressed. And that really can tie directly into criminalization and, the difference in how white people who use drugs are treated with compassion and people of color who use drugs are treated as criminals.
To sum up on a couple of points here, recently, members of the coalition, I guess, testified in Trenton about in opposition to harsher criminal efforts against the use and possession of fentanyl. Why did the organization take that position?
Yeah, so we take that position because from our lived experience and from the people we work with every day, we know that criminalization actually makes people less likely to call 911 for help when someone overdoses. We've heard that out of people's mouths. It's one of the reasons we make sure people have naloxone in case they won't call 911. You should call 911, right, when someone's overdosing. But we've heard people afraid, right? In New Jersey, every overdose death is investigated as a drug-induced homicide. And knowing that, I'm going to be really scared to call 911, right? And even though we have the Good Samaritan law, the Overdose Prevention Act in New Jersey, I still, just as a person in that lifestyle, I'm going to be really scared. And so if the penalties increase, and the penalties that are being proposed in New Jersey are such a low threshold that the way fentanyl use works, it's a little different from heroin. Fentanyl doesn't have legs the way heroin did. It doesn't have as long of a half-life. So I'm going to be using more bags of fentanyl if I was, than I would be using of heroin. The amount that is in these new penalties basically means that every single person that uses any kind of opioid, because we know that all opioids right now on the street have fentanyl in them, they're susceptible to not just criminalization, but felonies and mandatory minimums. And that is the exact opposite of what our lawmakers said, right? Our lawmakers expanded access to naloxone and treatment, treatment on demand. We have the amazing Reach NJ program in New Jersey and things like that. They expanded access because they believe that people who use drugs deserve compassion and deserve a chance to thrive and utilize evidence-based programs. So we're also pointing out that while these bills seem like a good idea, because we know that legislators want to do something, they want to save their constituents, they don't want to see people dying, right?
Yeah.
We know that they're well-intentioned, but they're just missing the mark.
Yeah, well, it's a knee-jerk reaction. I mean, here on the one hand, New Jersey seems very progressive in the notion of harm reduction and open to that idea and moving forward there. And then on the other hand, fentanyl scares the bejesus out of them, and they revert back to what they know well, and that's a heavy hand of the criminal justice system. So it's good that coalitions exist for people who walk in and say, "Wait, time out. Make sure you know what the results of this would be." Caitlin O'Neill, finally, with regard to the issue of decriminalization of drugs across the board, does the New Jersey Harm Reduction Coalition take a position on decriminalization?
Yeah, we support decriminalization of drugs and the people who use them. And I know that can sound like a radical concept, right? Again, because we're seeing all these stories, we're experiencing people around us dying. And what I know is that criminalization will not bring my former partner back. Criminalization will not bring my best friend, Danny, back, right? Criminalization will not bring back the people we've lost. And I say their names because, I do this work in honor of them. And while sometimes when we lose someone, we're scrambling, we want someone to pay, right? We want someone to be responsible. We have, as you stated earlier, 50 plus years to show us that doesn't work. It's not, drugs are still here. Drugs are here, as you mentioned, more prevalent than ever. And so if those criminalizations worked, they would have worked by now, and they do not work. And so we're in support of full decriminalization because we know that there is a possibility for change. We know that a legal regulated drug supply works. Look at our alcohol supply. In the 1920s, we didn't have that, right?
I was just about to say, if people think that's an unbelievably radical notion, consider that two of the most dangerous drugs out there have been legal and regulated forever, and that's tobacco and alcohol. So there's a model. It works. People want.
And look at alcohol prohibition. During alcohol prohibition, people were dying left and right because the doses were unregulated. A bottle this size that I might think has wine in it could have enough alcohol to kill me, right?
And history shows us that consumption of alcohol spread exponentially during Prohibition. The minute they said you can't do it, people wanted to do it.
Yeah, so it's really a mirror.
Yeah, we have models. It's not a utterly crazy notion to decriminalize drugs. We do it. We have done it routinely for decades and decades. Caitlin O'Neill, New Jersey Harm Reduction Coalition. Thank you for your time. You guys are supported by donations, I suppose, and you're always looking for volunteers.
Always, and always looking for volunteers and advocates. Yeah.
Okay, we'll have a link on the Behavioral Corner website for the coalition, and we thank you for your time and your work in New Jersey, and we'd love to have you back at your earliest opportunity.
Awesome, love to come back. Thanks so much for having me.
Have a great day. Thank you guys for your time. Check us out wherever you check out podcasts, and don't forget, like us, follow us, push the buttons, and check out the harm reduction efforts going on in your community.
Retreat Behavioral Health has proudly been serving the community for over 10 years. Here at Retreat, we believe in the power of connection and quality care. We offer comprehensive, holistic, and compassionate treatment from industry-leading experts. Call 855-802-6600 or visit us at www.retreatbehavioralhealth.com to begin your journey today.
That's it for now. And make us a habit, hanging out at the Behavioral Corner. And when we're not hanging, follow us on Facebook, Instagram, and Twitter on the Behavioral Corner.